This is another little yoga slash physical therapy routine for one of my patients who's just undergone a hip replacement surgery. She's about to go through another knee replacement surgery, and so I thought I would kind of help her to stay active, to do pre-op strengthening, as well as give her some rehab exercises for after until she's able to return back to my clinic. So this is for you. What I want you to do is go ahead and lift your knee up and place your hands slightly behind you so that you have nice open chest, right? You're going to go ahead and straighten the right knee and back. Straighten and back. Today what we talked about was because the vastus medialis, or it's the middlemost quadricep muscle, or your quad muscle, or your thigh muscle on the front side, is the one that tends to fire last. I told my patient, angle her toes slightly out to really feel that muscle kicking in as she straightens. Make sure you're not hinging back or slouched forward like this as you do this exercise. As long as you keep that knee high, that's going to really work that quad. For those of you who are at home because of some chronic disease and you can't really move right now, you're going through a flare of some sort, this is going to also help you to kind of keep your muscles from shrinking, atrophying. Because what you don't use, you lose. So you want to make sure that you do enough pre-op work as well as keep your muscles nice and contracted while you're at home recuperating from or recovering from a flare. And back. And this really enhances the metabolic activity in your body as well. So it's just a good, well-rounded exercise that you can actually perform. Okay, so then we're going to go ahead and lie on our backs. And then I showed her with the arms down by your side, keeping the shoulders away from your ears. Perfect posture. You're going to go ahead and lift your hips up and down nice and slow. Bring your hips up, 2 and 3. Use those quads, use your glutes. 4 and 5 and 6, 7, 8, 9, and 10, and back. So this particular patient has the left hip replaced. So I told her to get that left ankle on top of the right knee takes a great deal amount of strength. And so there's a little bit of a range of motion limitation. Those of you also who are homebound and going through a flare of some sort, specifically lupus, you might have some hip pain as well. So if you can get here, that's great. And if you can go further by eye of the needle through your legs and grab a hold of the right knee behind you and pull it up and stretching into the left hip, that would be a good thing too. And breathe. And down. Don't worry about it. Don't force it if you can't do it. This might be just enough stretch for you. And then back the other side, getting the right ankle on top of the left knee, oftentimes. That takes a great deal amount of strength on the right hip. So that's a good little exercise to even get to that stretch. And then pulling this left knee up towards your chest. If you have the range, that's great. If not, you just stay down here and just feel that stretch. I want you to repeat that 3 times on each leg, right? So that was 1, and this is 2. And hold it, ideally for about 15 seconds. 15 slow seconds in and slow seconds out. And then switch. and the other side. The more you do, the more at ease your muscles will fire. And neurologically, what happens is the path of least resistance. The more you do of a certain motion, it gets easier every time. And that synapse, that connection from your brain to your muscles, it enhances every time. So that's really the idea, so that you don't allow your muscles to get weak and atrophy, because if you don't use it, you really do lose it, and you don't want that. So I'm pulling my knee up. For those of you who have the range, this is the last one. We've done 3. Just showing you a different variation. Don't feel like you have to force your hips to go to that range you don't have. And then lastly, you're going to keep your heel toe together and knees together and gently do a stretch. And as the knees fall to the left side responsibly, you're going to look over your right shoulder. And then do the exact opposite. It should feel a gentle motion or stretch on either side of the spine, which really keeps your spine healthy and flushing out by using those muscles along the sides of your spine. Go back and forth. Back and forth. Good. Lastly, you're going to go ahead and bring your knees up and down, roll over to the right side, and carefully learn to come back to a seated position. Thanks for joining me.